Hello, thanks for joining us today. I'm Adele Gauthier from Breast Cancer Foundation NZ. Today we're talking about surviving breast cancer and what rural communities need to know. And I'm joined today by two experts on the subject who can help us discover that. Vicky Newman has had breast cancer a long time ago. She'll tell you a bit about that. Vicky is from Kaukopakapa. She's a former dairy farmer and currently and has also worked as a nurse. So some of you may have seen her if you've ever visited North Shore Hospital here in Auckland. We also have with us today Katrina Farrick. Katrina is a nurse at Breast Cancer Foundation NZ. She's had a long career looking after breast cancer patients, and these days she's providing advice and guidance over the phone to people going through that journey. So let's start with Vicky. Vicky, tell us, when did you have breast cancer? How did you find it, and what happened?
Well, I'm celebrating 20 years this year. I was 34 years of age and had a shower, felt a lump in my breast, was travelling out of town back to the rural community where I used to have a dairy farm and thought I'd see my old doctor there. She referred me back to Auckland and I had a mammogram and ultrasound the following week. They found a 4.8 centimetre tumour and with some spread, and obviously what that was on mammogram, and then I had ultrasound and biopsy. That was on Monday. On Tuesday I received the results very quickly. They were extremely speedy. I was 34 years of age. It was a bit of a rarity back then to see young women with breast cancer. And so Tuesday I got the diagnosis. Wednesday I saw a breast surgeon. Thursday I had a mastectomy.
Wow, that's amazing. So much in such a short time, and you were just so young, and it's really hard for young women to even think about finding breast cancer, let alone going through all that. Katrina, can you tell us a bit about finding breast cancer when you're younger?
Yeah, that's right, Adele. Breast cancer is rarer in younger women. The majority of breast cancers are found in women over the age of 50. However, it is possible for young women, even at the age of 34 or even younger, to be diagnosed with breast cancer. It is important for young women to know the signs and symptoms of breast cancer. It is important for them to know how to check their breasts and to check them regularly. Knowing you're normal, knowing what's normal for you, will allow you to detect and to feel anything that's new or abnormal. We follow a three rule way of checking your breast: TLC, touch, look and check. The most important thing to do with touching is feel your breasts. Use the pads of 3 fingers to feel your breast in a systematic way, starting from just under your collarbone, down to your breast tissue and up underneath your arm as well. You're checking to see if you can find any lumps, any unusual thickening. Then you want to have a look at your breasts, stand in front of a mirror, have a look at your breasts from the front and from the side. Also lift your hands above your head. It will allow you to see underneath your breasts as well. You're looking for any unusual rashes, any red area that doesn't seem to be going away. You're looking for any changes to your nipple. So whether your nipple is newly retracted or drawn inwards, whether your nipple is changing in direction a little bit. You're looking for any dimples, any puckering, any dents, and basically checking to see if there's any discharge from your nipples. If you notice anything unusual, anything different, that's where the C comes into play. C is for check, so check anything with your doctor or your healthcare provider. By checking regularly, when you go to your doctor and say, I've noticed something new, this is new for me, it's changed, it's something different, your GP then will assess you and refer you to the hospital if necessary for further tests and investigations. To help you check your breasts regularly, we have got a pre-check app on the website. You can find that at the Breast Cancer Foundation website, or you can download it from the Google Store or from iTunes. Pre-check app shows you the signs and symptoms of breast cancer. It also allows you then to set an alarm or reminder on your phone for once a month, where it will remind you to check your breasts, so it can be done regularly.
So it must be pretty nerve-wracking turning up to the GP with a lump in your breast. How likely is it that that's going to turn out to be breast cancer?
The majority of breast lumps, so 9 out of 10 breast lumps, are not breast cancer. However, until it's been investigated properly, it's difficult to know what it is. And even if it is a benign breast condition, it is still a good idea to get it assessed, to get it diagnosed, and to actually start any treatment if treatment is needed, or just even to monitor it and have surveillance for it.
Right, so basically, got a lump, any other symptom, go to your GP.
That's correct. And it's peace of mind. It's absolute peace of mind as well as anything else.
Great. And what about mammograms? When do they kick in?
Mammograms are recommended from the age of 40. So regular breast checking from the age of 20, but mammograms from the age of 40, and then from the age of 45, Breast Screen Aotearoa have a free mammogram program where you can have free screening mammograms done every 2 years. It is important to know this is an opt-in program. So some GPs will let you know that you've hit the age of 45 and it's time to enrol. But if you're not sure if you're on that program, either contact your GP or contact Breast Cancer Foundation and we can give you their direct numbers.
So Vicky, you were young, you did find a lump, you did go to your GP, you did everything right. But even after you had your surgery, you weren't done with breast cancer yet. What happened after that?
Oh, well, I did, 6 months of chemotherapy and radiotherapy after that, and was due to go to see my surgeon. And just before I was seeing him, we was going to have a chat about reconstruction. I found a lump in my neck. That obviously showed that the cancer had spread. They did ultrasounds and they biopsied it. And I then had to wait and see. I was lucky enough there was a clinical trial at the time for Herceptin, which is now publicly funded. It wasn't back then. It was an international trial and they had to send parts of my tumour away to make sure that I was appropriate for the trial, which I was, thank goodness, very positive. And I then went on to the Herceptin trial. Obviously my lump in my neck was in strings of grapes of lymph nodes all the way through my chest, showing that there was spread. It wasn't good. I was told I had 30% chance of responding. I wasn't likely to, not a great chance of possibly surviving. Quite stressful when you have a young family. And after 2 doses, it took my spread away, which is why I'm here celebrating 20 years now.
That is amazing. That really, really is. But I'm sure the fact that we're sitting here happily now doesn't take away from the fact that at the time it must have been just devastating, not just for you, but for your family. What kind of support was around in those days?
Nothing then, really, or nothing that you're aware of. I just started a breast care service at North Shore Hospital. I think Breast Cancer Foundation was in very early stages then. The first thing I thought was if we were still rural, which we'd moved back a year earlier, the stress levels would have been massive because we didn't have our family there. Rural's great though because the sense of community is amazing. But that was my first thought. Well, I'm happy to be with my family and friends in the city to go through this.
Yeah. What about the blokes though? Your husband, how did he get on at the time?
It wasn't easy. When you're going through these things, going through treatment, my thoughts were this is all about put your big girl pants on, and this is all about my family and friends and, surviving for them and going through that treatment. For my husband standing and watching that, for most men, it's a really, really difficult time to go through.
Would you agree with that, Katrina?
Oh, absolutely. Most men are fixers and doers, and it's something they can't fix, really, isn't it? We have got advice over the phone for any support person, be that your husband, parents, anybody like that. So they can call the 0800 BC nurse phone line at any time. We also provide free counselling for the person that's going through the breast cancer, but also any family member as well. That's free counselling. And we've got a really good book called She's Got Breast Cancer. And that basically talks to 16, 17 different men who have actually gone through breast cancer, either their partner, their spouse, their parents, and it just gives their coping strategies and their coping tips, and there's some really good advice in there. That can be ordered for free on the resource section of our website, or you can give us a call and we can get one out in the post for free as well.
Great, and that's written by the journalist Peter Calder, which
That's
I think
right.
a lot of watchers will know of Peter, and it's been really valued by many of the men who read it, we know that. What about other support, somebody to talk to, having to travel, things like that? Were those big issues for you back then, Vicky?
Not for myself, but certainly if I was in a rural community, it would have been massive, having to leave small children and travel and, you know, to have treatment. Usually, you know, I was working on the farm with my husband, so, you know, that would have been highly stressful to leave him with the children, you know, minus a worker. Yeah, definitely. But it's not a reason to be complacent about it, you know.
No,
and now there's so much support available out there, and it's so much more visible, breast cancer. True, yeah.
Katrina, what about recovery from surgery and things like that? What kind of support is available these days that might not have been around for Vicky?
There is plenty of support available, and that's irrelevant of whether you're in the city, a big town, or in the country. The support is nationwide. We provide some counselling for anybody who would like counselling at any stage of their journey. That can be just newly diagnosed, even somebody that's presenting with a symptom and they're concerned, right through to after treatment and survivorship and recovery. We provide funding for 4 one-on-one physiotherapy sessions with a cancer rehab physiotherapist, and that helps regain strength and range of movement after the surgery. That's very easy, just apply it online and we can basically approve the funding on that day. We provide some funding for some lymphedema assessment and therapy for those who are either at risk of developing lymphedema post-surgery or those who've got a newly diagnosed lymphedema. We also have got a really good online community support group called MyBC, and that's an online forum where women and men can get support and advice from peers, basically people going through the breast cancer journey themselves. That's also moderated by a nurse, so they can pose private questions to a nurse or ask questions to a nurse as well. Yeah.
And I think for my personal sort of pride in some of the services that we offer for patients include our webinar program, which I think for people in rural communities are a real asset, where you can listen to medical professionals and patients discussing an issue such as managing chemo side effects, and you can actually ask questions to an oncologist or to an oncology nurse like Katrina, and those have been very popular around the country.
Yeah, and they cover all aspects of breast cancer care, from diagnosis to young women with breast cancer, reconstructive options, preparing for surgery. They basically cover all areas, you know.
Yeah, now we've talked quite a bit about online and remote support elements, but we do also have a pink caravan that you might see travelling around small town New Zealand. Katrina, can you tell us a bit about the caravan?
Yes, Pinky actually got interrupted a little bit with COVID-19, but the caravan started in the bottom of the South Island down in Bluff earlier on this year, and it had intended to travel all the ways up to about Palmerston North, but it got stopped in its tracks. It's currently in the lower North Island, and it will restart its tour again in Northland come springtime. Pink Caravan gets out to rural and remote communities, and it is available for some free health advice, free guidance. It also goes and visits GP practices rurally, and you'll basically get a calendar of where it's at from our website, and it would be great to see people popping along to it.
Great. Vicky, now that you're 20 years down the track and the benefit of hindsight, what's your advice to rural folk in that situation where they might be worried about their health, their breast health?
Definitely to go and do something about it. You know, my mother had a history of cysts, and I thought that mine was a cyst, but it didn't stop me from going and seeing the GP and following on. You know, the people are living. You know, people live, people survive from cancer. You know, I'm sort of testament to that. So, yeah, I just think that we have a bit of a she'll be right attitude in New Zealand, and sometimes, you know, that's probably not appropriate. If you find something, it's really important to go and get it checked out. Yeah, and I've had a lot of people approach me about concerns that they've had, over the years, and so, yeah.
Yeah, and while it might be harder for rural people to get to the hospital, Katrina, once they get there, they have very good outcomes. Is that
Absolutely,
right?
the outcome in rural New Zealand is just as good as it is in the big centres, which is unlike a lot of other countries around the world. Unfortunately, there still are fatalities in New Zealand from breast cancer, and that's something that we're absolutely trying to get on top of and trying to reduce. With regards to treatment from breast cancer, the same treatment is available all over the country. From a support point of view, your breast care nurse might be able to actually indicate what local community support groups are there. Your cancer society, there's lots of support and guidance while you're going through the treatment as well, even if it's on a personal level. So.
But sadly, we still do lose 650 women a year to breast cancer in New Zealand, and that's where we are working to bring treatments to New Zealand earlier for patients, to provide better support and to help them get through the system with the best possible outcome.
Yes.
Yeah. And on that vein, Vicky has taken a really lovely step this year to celebrate her 20-year milestone. Can you tell us what you're doing for us, Vicky?
Well, I received an email from the Breast Cancer Foundation, and I hummed and hawed, and I thought, no, it's my time to give back. So I had a pink ribbon breakfast. I had a raffle as well, and have been inundated with donations, which is amazing, from strangers as well. I've raised $12,000.
Wow.
As of last night.
Well done.
So it's gone up again. Fantastic. Giving back to a charitable not-for-profit organisation that provides such amazing support out there for women going through cancer, or men.
Thank you. Thank you so much, Vicky. We really appreciate that effort, and the funds raised from Pink Ribbon Breakfast do go to helping support women with breast cancer, to funding research into new treatments and clinical trials, and also to getting those awareness messages out to people around the country, telling them the signs of breast cancer, telling them how to check their breasts and what to do when something isn't quite right. That's it from us today. Thank you so much, Vicky and Katrina, for spending time here and sharing your stories and your expertise with us. We really appreciate it. For more information about Pink Ribbon Breakfast, visit pinkribbonbreakfast.co.nz, and for more information about our services, you can check the Fieldays hub. Thank you very much.